Hi, Dr. John Torres here in this Facebook Live where twice a week I go over headlines. I'm going to cover a couple headlines and then we get to answering your questions. And so please send us questions you have because we try to get to as many of those as possible. And the headlines, I cover them not just to give you information on what the headline says, but get behind that headline and understanding what that means for you, your family, your loved ones, and your community, and hopefully give you some tips you can go away with that'll help you get through this pandemic sooner rather than later. Let me go ahead and start with the headlines. The first one I want to talk about are the numbers. And if you look at the numbers right now, last daily cases, around 69,000 cases a day. That is a very large drop from 300,000 cases a day we just had a little over a month and a half ago, where those numbers were astronomically high, and we were concerned because the numbers didn't seem to come down. Well, now they're starting to come down precipitously. But you also have to remember that if you look at last May-June timeframe, particularly in June, we were down to around 20,000. So we're still a lot higher than that number. And even when we were down to 20,000, we said we still need to drive it lower. And that's when we can start noticing that, hey, we're getting through this pandemic and we're starting to make some headway here. So those numbers dropped off, not unexpected, because now we know that that holiday rush, that holiday travel season caused these spikes in numbers. These spikes in numbers are now coming down, partly because of that holiday travel season being over and us being more than 6 weeks away from that, which is kind of the time period it takes to get through the whole hospital cases, hospitalizations, and deaths. And I've talked many times about how those two are in 2-week increments, where you have, after you get infected, 2 weeks later, that's when cases start going up. 2 weeks after that, hospitalizations start going up. And 2 weeks after that, you start seeing the deaths, and then they slowly start tapering down. We're there right now. But why are we at those numbers, and what can we do to drive them even lower? Well, some people say we're at those numbers because so many people are getting vaccinated. But if you look at the vaccine numbers right now, around 5% of the U.S. population is fully vaccinated, meaning they've gotten both vaccines and they've had that 2-week period after the second vaccine for it to fully take effect. And so that's when we start to say, okay, that's when you're fully protected. If those numbers are high enough, that's when they should start affecting the cases and start dropping the caseload. So we're not anywhere even close to there yet, but it might have some impact in certain areas where there's clusters of cases that are higher, and that's what we're seeing. And I'll talk about that in a minute here. But the other thing is human behavior. Are we behaving differently? And I think people are going back to, okay, we need to mask, we need to social distance. That message is getting out there more and more. And it's not turning out to be quite as controversial as it was before. For whatever reason, it was controversial. Now, since that is happening, we're starting to see these numbers drop. And the honesty of it is, the big driving factor behind these to get it even lower is going to be human behavior. Wear a mask, watch your distance, wash your hands, open windows, avoid large groups. All those things we know we need to do. We're tired of doing them, but we know we need to do to get through this pandemic. The sooner we do that, then the sooner we're going to end up having more case drops. We're going to have lower and lower numbers of cases, and we're going to start getting through the pandemic. As that happens, we're going to start getting the vaccines to kick in as well. And the vaccines, although they're still ironing out some of those wrinkles that have been causing issues, they're starting to get more and more vaccines out there. They're getting close to 2 million vaccines a day. Where if you think about it, U.S. adults, around 200 million, 220 million U.S. adults that need the vaccine. So that means they need to go a lot further to get them at 2 million a day. That's still well over 100 days to get those. By some speculations, people will be able to get the vaccine at any group, anytime they want it, will be able to get the vaccine somewhere, probably May-June time frame. The speculation has been anywhere from April to July, depending who you listen to. But things are starting to get a little more robust. They're starting to get the vaccines out into more of these communities. And as I've said before, instead of people having to go to the vaccines are starting to go to where the people are, which is going to be very important, especially reaching those communities where they don't necessarily have the ability to get to the mass vaccination events. Getting them into pharmacies is going to help, but getting them even more widespread is going to help even more. But now this begs the question about, okay, are the vaccines helping, and are they helping particularly with variants and transmission? Well, with variants, we know these vaccines don't seem to be as effective against the variants, especially that B1351 that's out of South Africa. That variant is more contagious and possibly deadlier or more dangerous than what we call the wild virus that's been here for months on end. And the reason is because it's easier for people to catch it. We also think that it possibly is that people have it longer. and have symptoms longer, and so maybe that's why they're spreading it to more people. But the vaccines don't seem to be as effective against them. However, what we're finding out is the vaccines seem to help in one endpoint, and this is the important endpoint. They seem to help prevent serious infection, complications, hospitalizations, and deaths from COVID, which again, what I tell people often is, if you have the vaccine and you do end up getting COVID, but all you have are the sniffles, and it goes away after 3 or 4 days, like a cold normally does, and you have no serious long-term complications or no long-term complications, because of that vaccine, that's a win. That vaccine is working very well. But the other side of the coin is we want to make sure the vaccines work at preventing transmission. And we simply don't know yet because they're still doing the studies. When they did the original human trials, they looked at the vaccine preventing disease, not preventing transmission, so they could get through those trials quickly enough to get it for us so they could start saving lives, which again is an important endpoint. But now they're looking at transmission. And what we're seeing in these clusters is that it seems to help out. The biggest cluster is in Israel. Israel is doing a great job of vaccinating their citizens at a very rapid rate. And since they have over 50% of the population and over 80% of those above the age of 65 have been vaccinated, they're seeing their numbers drop incredibly well. And on top of that, they're seeing transmission rates drop as well. And so that's a clue that we think these vaccines are helping with transmission. On top of that, if you look at nursing homes where they've vaccinated a lot of both residents and staff, if you look at, there's fire departments that have said, okay, we've vaccinated a lot of our staff and they're not getting COVID. In a nursing home, COVID doesn't seem to be spreading. So we're seeing what we call anecdotally in these certain areas that it seems to be working to quell that transmission, which is important. But at the same time, we need to find out on a more robust nature what's happening across the country. And so they're looking at that as well. And that, once we find out, it prevents transmission. Once we find out, it prevents COVID complications and deaths. And once we get those numbers under control and get those cases down by getting more herd immunity up, then that's when we can start pulling back on the mask mandates, pulling back on the social distancing mandates, and hopefully getting back to a normal, or at least a near normal life. We're thinking that's probably going to happen around late summer, fall time, maybe even winter time. It's hard to tell. But again, a lot of this is driven by human behavior. So the more of us that do those measures that I know you're sick and tired of hearing about, wear a mask, wash your hands, social distance, open a window, avoid large groups, the more of us that do that, the sooner we're going to be able to get back to this near normal life, with the vaccine put on top of that as well to help us get there even quicker, hopefully. So again, talked about a few things here, talked about the numbers, talked about the transmission rate. But the one thing I want to show you right now is NBC News has come up with a website. Actually, NBC Universal and Comcast have come up with this website because part of that is getting your vaccine, part of what I'm talking about. If you can't get your vaccine, it's going to be difficult to get that herd immunity level. And up until now, it's been difficult because you have to go to a variety of sites. People saying it's almost like trying to play the lottery, where you get on every site you can find, you sign up for everything, you make all the phone calls, and then eventually you break through after weeks and weeks of doing that. Well, NBC is trying to help. So here's what they came up with, and I'm going to show it to you here. So I'm kind of breaking the magic of television by showing you, essentially this is a screen behind me, and I'm going to show you what we did here and how that can help you. So if you look at the screen here, and I'll move over to the side, the website is called planyourvaccine.com. planyourvaccine.com, and I'll walk you through it real quickly here. So here's what the website does. If I can get my cursor working, there it is. All right, so planyourvaccine.com. And then if you look here at the website, it says planyourvaccine.com. It's in English, Spanish, and Mandarin, so which is great because, again, this helps those areas where we aren't necessarily getting the vaccine in, those communities that we're really worried about. So when you go here, you'll notice that it has planyourvaccine.com and it has a lot of drop-down menus. So here, I'll use my state for example. I'm in Colorado. Once I select a state, then it asks me to select essential occupation. If I don't have an essential occupation, I just simply click right here where it says non-essential. And what it'll tell me, you'll see later on that I'm not eligible yet, but there's a way to find out when you're going to become eligible using this site. So essential occupation. So right now I am a healthcare worker in contact with COVID patients. I volunteer at a homeless clinic. If you go down here, age group 65, I'm under 65. What that does when you click that is it opens up further drop downs here. And if you look at the drop down, it has all the states, and you can go to your state and it'll show you a variety of different things. Let's go to one that's up here, like Arkansas. Okay, it'll show you here, 8.9% of people have been vaccinated, fully vaccinated. 53% are now eligible. 8.4% will be eligible next. And it shows you where that herd immunity. We picked 80 to 85% just to make sure we had a robust herd immunity. And it's showing you the line, those that are fully vaccinated, those that are now eligible, and it's getting towards that. 73% of its allotted vaccines have been used. Alaska ranks in the bottom third of the country. So let's go to another one. Let's go to Colorado, where I live. If you look at Colorado, it's saying here that right now Colorado is, and I'll bring it up a little bit, Colorado is the top third of the country as far as getting people vaccinated, using its allocated vaccines. And so looking at that can give you a lot of information. That's good information, but that's not going to really help you get your vaccine. But information is what you need. So if you look down here, it tells you, what's my state's vaccination distribution plan? And it goes down here and talks to you about that. And what NBC has done is they have contacted all the state health departments, they have contacted pharmacies, and they are continually in contact with them. So if those things change, they're going to change the information here. And that's going to come in handy pretty soon. So as you go down, you'll see more and more information about that. And then down here, it'll tell you, based on what you put in, you are eligible now. See where you are compared to the rest of the state. So I'm in this eligible now category. I've got my shots already. And so that's the reason I got them. And then it breaks down why you're eligible, who the different groups are. I fall into this healthcare worker group. And then you can keep going down, and it'll show you who's going to be eligible next and where you go from there. But here is the kicker. Here's the important part about all this for you. Remember I was talking about it's almost like the lottery where you're constantly on. You're constantly trying to find different websites you can link up to, different lists you can get on, making phone calls. Well, we're doing that for you. So right here it talks about how will I be notified once it's my turn to receive the vaccine. And it's going to be very state dependent. And as you look here, public health, the sources we use, public health websites, state press briefings, public health officials, health departments, social media pages. So we're following their social media pages. Once they update things, we're going to update this as well. And then what you can do is you can go here, sign up for NBC News alerts as changes are made to your vaccination plan. So you can sign up here, put in your state, like in this case I would put in Colorado, I put in my email, and I'd say I want to sign up for breaking news alerts from NBC News if you want those. But even if you don't, if you submit, it's going to email you every time there's a change in the state you put in there. Now, the reason we have multiple states is, let's say I live in Colorado, but my parents live in Texas, and I want to find out what's happening because I'm trying to get my parents the vaccine as well. Well, I can put Colorado and Texas in there, my email address, because my parents might not be able to get on the computer as well as I can, and I can get that information for them and let them know, and it's their turn to do that, and how they need to sign up for it. So, and then there's some news articles here that you can read as well. If you want more information, it talks about the requirements in my state. And it even talks about, because eventually at some point, we're probably going to have to prove that we got vaccinated for whatever reason, whether there's vaccine passports or whether it's for our employers or for a variety of reasons. At some point, we're probably going to have to prove we're vaccinated. They're talking here about how you can prove you're vaccinated. That's very, very state dependent. And again, the sources they're using are the same ones we talked about. And then how do I need to make an appointment? You go here and you click on here and it'll take you to your state's sites that show you how to sign up for these vaccines. And so it goes right to your state sites and it shows you exactly how to sign up for these vaccines. So again, this is a wonderful, wonderful resource. Another thing you can use, if you look here and looking at the zip code it put in for me, within a 250-mile radius, which obviously is much, much longer than I want to be, and you can drop that radius down, it basically shows you where all the pharmacies are, and in those pharmacies, it shows you how much vaccine you have. Now, one caveat we do say is if you do that, then go ahead and call the pharmacy if you look at it, like this King Soopers here, we use that as the first example. It gives you the phone number. You need to, we're saying that, yeah, they're telling us they have the vaccine. You need to call ahead to make sure they have the vaccine because it could be that they have it right now, but they already have appointments set up for the rest of the day. So call them before you go there just to make sure. But again, a variety of things you can use on here. You can sign up. You can get those notifications. You can find out with the pharmacies, and we use a lot of pharmacies, both all the major pharmacy chains and plus local pharmacies as well. to find out who's participating and who is at what level and what you need to do. And so again, an important one-stop shop for you to get your vaccine. I'll give you that website again. It is planyourvaccine.com. I'll go back up to the top so you can see it. planyourvaccine.com. A very, very, very important website for you to use. Now, we've talked about the numbers, we've talked about transmission, and we've talked about planyourvaccine.com, so hopefully it can help you get the vaccine either for yourself or for family members or loved ones, because you can search for them as well. But now let me see if you have any questions. I'm going to go back to, as I call it, the magic of television. Let me get to where we were. Wait. All right. And
I read online that if you've had COVID, you only need one shot. Is this true?
You know, some information came out today saying that studies are showing that if you had COVID, then you might only need one shot. However, right now the FDA has said we need to stick with the two-shot regime we have, the two-shot dosing for Pfizer and Moderna. Johnson & Johnson is coming out. That's going to be a one-shot dose. And so we need to make sure we stick with what we have right now, because we know through human trials, through testing, that's what works. The other ones we're starting to do studies on, and it's possible that down the line, a month or so from now, we say, okay, if you had COVID-19, then you only need one shot. But here's the kicker. If you had COVID-19, we don't know at what level you're going to have that antibody response in your body, because it depends on what we call viral load, how much of that virus you got in when you had COVID-19, because that's going to basically dictate how your immune system responds, how robustly. When you get these vaccines, you get two vaccines. The first one is what we call the primer vaccine. And since you've never been exposed to COVID, for most of us, that primer vaccine basically introduces your immune system to COVID. It says, this is the virus you're looking for. Get ready in case it comes along. And then 3 or 4 weeks later, depending on which vaccine you have, you get a booster dose. And that booster dose says, okay, now my immune system knows what it looks like. It knows what to attack. Let's train it to attack and let it build up its army of antibodies. And so that's the booster shot. What speculation is that since you had COVID and your immune system's already seen it, you might not need that primer shot. You might just need the booster shot. But again, that's all speculation. Now, the question you might be asking yourself, well, what about the Johnson & Johnson vaccine? Because that's a one-dose vaccine. Well, Johnson & Johnson vaccine, since it uses a different technique, instead of the mRNA technique for Pfizer and Moderna, it uses what's called an adenovirus technique. So basically it takes a altered, essentially killed adenovirus, puts in the mRNA or the RNA for the spike protein, which I'll show you here, you know, the spike protein on the ball, and it has your body produce a spike protein, so that way the immune system knows what to look for in case the coronavirus ever comes floating around throughout your body. Because of the way it's set up, you only need the one. It's basically the primer and the booster all in one dose. But as of now, you do need 2 doses of Pfizer and Moderna. Again, that might happen at some point, but more studies need to be done.
Should we take Tylenol after our second COVID vaccine to help with symptoms?
Should you take Tylenol after your second COVID vaccine to help with symptoms? And let me push this back a little bit. So a lot of times, or not a lot of times, but some people say, okay, you know, I want to make sure I don't have symptoms. When I had my shot, I had sore arm, a little bit of fatigue, maybe a little bit of dizziness that went away after just a few minutes. And then really not much beyond that. Some other people are bedbound for a day or day and a half trying to get through this. And that's usually, that's an indication that your immune system is kicking in and developing what it needs to develop to fight off the virus. Some people say, well, I don't want those symptoms, so I'm going to take Tylenol, which is acetaminophen, or ibuprofen before I go and get the vaccine. Well, the CDC and experts have said don't do that, because there is the theory, and it is theoretical at this point, there is the theory that if you do take ibuprofen or acetaminophen, you could tampen down your immune system response to that vaccine, and we want that response to be as robust as possible. That doesn't work the same way the next day, because your immune system is already attacking the virus or what it thinks is the virus. And so if you take ibuprofen or acetaminophen at that stage, then it shouldn't hinder it. However, ibuprofen is a fairly powerful non-steroidal anti-inflammatory. And since it's an anti-inflammatory, and we want you to have a little bit of that inflammatory response, because that's your immune system fighting off what it perceives to be the virus, we're tricking it with the vaccine. what experts are saying is err towards acetaminophen, err towards Tylenol instead of ibuprofen, because that should make sure that that doesn't happen, but still help you with the symptoms. But don't do it until you wake up the next day. And if you don't have to do it, great. Use ice. Move your arm a lot so it's not as sore. Plenty of fluids. Don't wear heavy clothing because you might have low-grade fevers. All those things we typically do. You do those first, and if you need to take the acetaminophen, then go ahead and take it at that point.
If I have active allergies with symptoms, am I okay to take the vaccine? I have an appointment.
If I have active allergies with symptoms, can I still take the vaccine? Yes. Bottom line is yes, you can still take the vaccine. The allergies work on a different system than your immune system response to the vaccine itself. And I know some concern that people have is, if I'm having allergies, will I have an allergic reaction to the vaccine? No. Because again, those are two different systems looking at two different things. One's the histamine system, the other are the antibodies or the T cell systems in our immune system. And so even if you have allergies, if you have active allergies, and by that we mean sniffling, sneezing, hay fever kind of stuff, then you can still get the vaccine. All of us have to wait 15 minutes afterwards. If you have a history of severe allergies, if you have had reactions to shots in the past, not COVID, but other shots in the past, then they'll probably want you to wait 30 minutes. Just talk to them beforehand. If you've had a reaction to a COVID vaccine, then you should not get your second one without first talking to your doctor.
How close are we to have a vaccine for a high-risk 14-year-old group?
So it's a great question. How close are we to having a vaccine for high-risk 14-year-olds? And the hope is that we get older children to get vaccinated by the summertime, so when they go back to school in the fall, that they're more protected and the staff is protected and their families as well. Because we know when you look at school systems, the elementary school doesn't seem to be an issue. In elementary school, they seem to have low transmission rates of coronavirus, both among staff and among students. Once you start getting to middle school, it goes a little higher, and then high school starts getting towards that adult level of passing on coronavirus. But it doesn't seem to be happening at the school. It seems to be happening after the school, usually in locker rooms, usually at parties that students might have on a weekend, extracurricular activities. And so they're looking at, okay, how do we do that to make sure they're safe? But that begs the question that's being asked here, what if you're high-risk 14-year-old and you need to get the vaccine to protect yourself? Well, at this stage, it's not been approved for that, but it's being tested for it. And right now, these vaccine manufacturers are looking at 12 to 17-year-olds. Pfizer, you can get it, Moderna, you can get it 16 and above. But for the 12 to 17-year-olds, for all the vaccines, Johnson & Johnson, Pfizer, and Moderna, they're testing them right now. They had to test them on adults first to make sure they're safe. And then they'll start dropping down in age groups. They're hoping they get through those tests here fairly quickly. They get them over the next couple of months. And so by summertime, and particularly by the time you're ready to go back to school, that you've been vaccinated, that 14-year-old group would be in that group. So keep our fingers crossed that that, in fact, does happen. So again, thank you very much. Fantastic questions as always. And just going over the headlines we talked about the numbers, how right now we're 69,000 cases a day, under 70,000 cases a day, which is great, but it's not nearly as low as those numbers we had back in June, which were down to 20,000 cases. And even then, we want to drive them even lower. The key to that, human behavior. Masks, social distancing, washing your hands, opening windows, avoiding large crowds, the things we always talk about, plus the vaccine is going to help us get to those low levels, get this pandemic under control, and make sure that we can get back to at least a near normal life and hopefully summertime, fall time frame. Then we talked about transmission. It looks like, based on what we're seeing in Israel, nursing homes and certain clusters here in the U.S. that have high vaccination rates, looks like transmission is getting better controlled. But getting a vaccine can be difficult, so I also talked about the NBC website, planyourvaccine.com, planyourvaccine.com, one-stop shopping. You can go not only to find out information about vaccine distribution in your area or across the country if you'd like, but also you can sign up for alerts that tell you if any of that has changed, if you're now eligible for it, whereas you weren't before, and it leads you to where you can go to sign up for the site, so you don't have to constantly go on a variety of websites to try and do that, and you don't need to do it round the clock. We're doing that for you. So again, planyourvaccine.com. So hopefully all this helps out. And again, like I always say, I'm hoping to give you information that can help you, your family, your loved ones, and your community get through this pandemic sooner rather than later, and as healthy and as happy as possible. I hope you have a fantastic weekend. Thank you very much.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.